For all the progress we seem to be making in talking about mental health, the numbers on access to care here in the U.S. are still, well, frankly, alarming. Millions of people are facing a real struggle to get the support they need. But what if the tools we use every day, our technology, could actually start to close that gap? That's the question we're really digging into today.
Exactly. In this deep dive, we're looking at the very tangible obstacles that prevent so many from accessing mental health services and, well, how artificial intelligence is presenting itself as a really interesting and potentially transformative set of solutions.
Okay.
We'll be exploring the core reasons why it's so difficult for people to get help right now and the specific ways that AI is being developed and used to try and address those fundamental issues.
And ultimately, our goal is to understand how AI could make mental health support more readily available and more equitable for you, our listener, and for people all across the country.
Right.
Whether you've personally encountered these challenges or know someone who has, understanding how technology might reshape this landscape is crucial. So let's really get into it. What are the biggest hurdles that are standing in people's way when they try to access mental health care?
Well, a foundational problem is the significant shortage of qualified mental health professionals. The data really underscores this. There are numerous counties across the United States where there isn't even a single practicing psychiatrist.
Wow, really? Not even one?
Not one. Imagine the implications of that entire communities without local access to that level of specialized care. This shortage isn't felt equally either. It disproportionately affects rural areas and communities of color, where the challenges extend beyond just finding someone with expertise to also finding professionals who understand the specific cultural context of their experiences. It can be incredibly difficult.
That really puts the scarcity into perspective. It's not just a matter of convenience. It's about fundamental access. And as you said, even when someone does manage to find a provider, the wait times can be incredibly long, right?
Absolutely. The figures on wait times are quite striking. We're talking about 94 million people in the U.S. who have reported waiting longer than a week to access mental health services.
94 million, that's huge.
It is. And for many, that week is just the beginning. These delays can stretch out for months, and sadly, what often happens is that people become discouraged and, abandon their efforts to seek treatment altogether.
Well, that's heartbreaking.
Yeah. When someone decides to reach out for help, that moment is so critical, and these prolonged waits can have really serious consequences.
It's genuinely disheartening to think that someone takes that difficult first step towards seeking help and then hits such a significant wall. And then on top of that, even if you can find a provider and you're prepared to wait, there's the financial aspect, which is a major barrier for a huge number of people.
That's completely accurate. The cost of mental health care can be a major deterrent. Even with insurance coverage, the out-of-pocket expenses for things like therapy sessions and medication can create a significant financial strain on individuals and families. And the issue of out-of-network providers further complicates this, severely limiting the options for affordable mental health care. It essentially creates a situation where access to care is often heavily influenced by a person's financial resources.
It's a difficult reality to face. And it's not just about location or money, is it? There are other factors that can create even more obstacles for certain segments of the population.
Exactly. We also need to consider the very real challenges posed by language and transportation. For individuals who don't speak English fluently, finding a therapist who can effectively communicate with them in their native language is a substantial hurdle.
Yeah, I can only imagine. Communication is key.
It's so central to the therapeutic process. Similarly, people who lack reliable transportation often face immense difficulties in attending regular in-person appointments, particularly in areas where public transportation options are limited. These factors can lead to further delays and, in some cases, completely prevent individuals from getting the mental health support they desperately need.
So we've outlined some really significant and multifaceted challenges. Now let's turn our attention to how AI is entering this space and potentially offering some much-needed solutions. Where are we seeing AI starting to make a real difference?
Well, one of the most promising areas is in the realm of early detection and intervention. AI tools have a remarkable capacity to analyze very subtle patterns within various forms of data. Things like the way someone speaks, the text they write, even changes in their behavior.
Interesting.
That could indicate the early stages of mental health conditions such as depression or anxiety. What's particularly interesting here is how something called natural language processing, or NLP, can be used.
NLP.
Think of it like a sophisticated language detective. looking for patterns in how we express ourselves digitally. NLP can identify emotional cues in our communication, which can then allow for earlier interventions, often before these issues become more severe.
So it's kind of like an early warning system.
Exactly. This proactive approach to mental health support has the potential to be truly transformative. For you, as someone who communicates digitally every day, imagine a system that could gently flag potential concerns based on your patterns of communication. That's the kind of power we're talking about.
That's a fascinating application, the idea that AI could pick up on these really nuanced signals that might be easily missed in traditional assessments. Another area where AI seems to hold a lot of promise is in expanding access to care, right?
Right.
Making it easier to actually connect with something.
Absolutely. AI-powered chatbots and virtual therapy platforms can provide mental health support around the clock, 24/7.
24/7, wow.
Yeah. Consider the implications for someone living in a remote or underserved area who might not have any local therapists. These virtual tools can offer immediate support without the need for in-person appointments, significantly reducing those long wait times we discussed and completely overcoming transportation barriers.
Right, no travel needed.
Exactly. It's really about bringing the support directly to individuals wherever they happen to be.
That's a powerful way to think about it, taking the support to the person in need rather than the other way around. And beyond just that initial point of contact, can AI actually play a role in the ongoing treatment process itself?
Yes, it can, through the development of more personalized mental health treatment plans. By leveraging predictive analytics, AI can analyze a wide range of data, such as a patient's medical history and patterns in their behavior.
Okay, so using data patterns.
Essentially, yeah. It's about using data to make informed guesses in this case, predicting which treatments are most likely to work best for a specific individual based on patterns observed in many other similar individuals. This allows for the tailoring of treatment plans, recommending specific therapies or interventions that have the highest probability of success for that unique patient. It's a move towards more effective and targeted mental health care, rather than a one-size-fits-all approach.
So it's about moving beyond general recommendations to something much more tailored to the individual, like really specific for me.
Precisely. And let's not forget the language barriers we discussed earlier as a significant obstacle. AI is also providing some really valuable solutions in that area.
Okay, yeah. Tell me more about how AI is helping to overcome those language hurdles.
AI-driven translation tools are making it possible for non-English speakers to access therapy in their native language. This is absolutely critical because effective communication, as we touched on, is fundamental to the success of therapy. By helping to bridge these communication gaps, AI is directly contributing to a more equitable landscape for mental health access for a significant portion of the population. For you, if you were trying to help a family member or friend who speaks a different language find mental health support, these AI tools could be a game changer in connecting them with appropriate care.
That's a fantastic development. Removing that language barrier could genuinely make a world of difference for so many people who have been underserved. And what about the financial burden we talked about earlier? Can AI also play a role in reducing the cost of mental health care?
Yes, potentially. Digital platforms that utilize AI can often operate with lower overhead costs compared to traditional brick-and-mortar clinics.
Oh, okay. Lower running costs.
Right, and these savings can potentially be passed on to patients in the form of more affordable care options. Furthermore, we're seeing the emergence of more affordable alternatives, such as AI chatbot-based cognitive behavioral therapy, or CBT.
Chatbot CBT, how does that work?
Well, it guides users through structured CBT exercises and techniques via text or voice interaction. These tools can provide a level of quality mental health support that is more accessible for individuals who may have limited financial resources. It's not the same as a human therapist, but it's a potentially very helpful option.
So it's not just about making care more accessible geographically or linguistically, but also economically. That's a really crucial point to consider. And it sounds like AI isn't just a tool for patients, it can also provide valuable support to the mental health professionals themselves.
Exactly. AI can assist mental health professionals in a number of ways that can ultimately improve the quality and efficiency of care. By automating some of the more routine administrative tasks, such as scheduling appointments and managing notes.
The paperwork stuff.
Exactly, the stuff that takes up time. AI can free up therapists to dedicate more of their valuable time and focus directly on interacting with and treating their patients.
Makes sense.
Additionally, AI has the potential to analyze vast amounts of data and offer data-driven insights during therapy sessions, which could potentially improve diagnostic accuracy by identifying patterns that a human clinician might not immediately recognize.
So almost like a helpful assistant providing extra context.
Kind of, yeah. Offering insights based on data patterns, perhaps suggesting avenues to explore, but always with the clinician in control.
It really does sound like AI has the potential to be a genuine game changer in tackling these long-standing challenges within mental health care. But with any powerful technology, there are always important things to keep in mind, right? Especially when we're talking about something as personal and sensitive as our mental well-being.
Absolutely, and this is critical. We need to talk about ethical considerations like data privacy, mitigating algorithmic bias, ensuring transparency in how these tools work.
Right, the bias issue is huge.
It is. And, crucially, maintaining human oversight. One crucial aspect to emphasize is that AI should be viewed as a tool to augment, not replace, the essential human connection that therapists provide.
Okay, augment, not replace. That's
Yeah,
key.
definitely. That therapeutic relationship built on empathy and trust is fundamental to healing. AI can be incredibly helpful in supporting and extending the reach of human clinicians, but it's not intended to be a substitute for that vital human element. We need that human connection.
That makes perfect sense. It's about finding the right synergy between technology and the human touch in providing care. It's a tool, a powerful one, but still a tool.
Precisely. AI offers a powerful way to complement traditional care by addressing those critical gaps in access and efficiency that we discussed at the outset, filling the holes, basically.
So as we look ahead, what's your overall perspective on the potential role of AI in the future of mental health care? Are you feeling optimistic?
I'm genuinely optimistic, yes. Cautiously optimistic, perhaps, given the ethical considerations, but optimistic nonetheless. I believe that through the thoughtful and strategic integration of AI into our existing healthcare systems,
Thoughtful being the key word there.
absolutely, we have the potential to move towards a future where essential mental health services are readily available to everyone, regardless of their location, the language they speak, or their financial circumstances. The potential to reach more people, facilitate earlier interventions, and personalize treatment approaches is truly significant and offers a real opportunity to address this ongoing crisis.
It certainly sounds like a future with a lot of promise. The challenges in mental health are complex and, there's no single easy answer. But it does seem like meaningful progress is possible when we combine informed policy decisions with the innovative power of technologies like AI. It really makes you consider how these advancements could contribute to a more supportive and accessible landscape for everyone's mental well-being. It's not just about the tech, but how we choose to use it, isn't it?